This is this is where we had stopped in the last class. Like we spoke of the desires and aversions of Ethusa. Okay. See, now next 30 minutes I will try to focus on 3 important areas of Ethusa. Okay. So what we did was we spoke of sphere of action, we spoke of ailments from, and we also spoke of the characteristic symptoms. Okay. Now 3 more areas. One will be the mind. The mental symptoms of Ethusa, that will be one component, and under particulars I will be trying to touch 2 areas. One is the GI, the other one is nervous system. Good. Okay. So we will just look at a small recap of the recap. I hope we are clear. Ailments from, sphere of action, and characteristic symptoms. So we will next focus on the mind. See, now the mind of Ethusa, there are few points which I have already given you. How is the mental symptoms of Ethusa, or what could be the probable mental symptoms of Ethusa? From the common name, what do you understand? It is a remedy given for fools. Okay. What does the author tell, or what does the author has in his mind when he tells it is a remedy for fools? Meaning, Ethusa patients, okay, mentally they are not very intelligent, mentally they are not very sharp. Children are Ethusa patients who are generally weak. They have issues with concentration, they have issues with memory, they have issues with understanding. Typically a remedy given for fools who have less understanding. So we will just go step by step and we will try to understand. The first point I want to highlight here is Ethusa is a remedy for people. So Ethusa is a remedy for or Ethusa patients are patients who are very introverted. Fine. People who are introverted. Who are introverted people? People who don't communicate too much. Okay. People who talk very less. Exactly opposite is extroverted. They are very open, they talk too much. So Ethusa is an introverted person. They are not very good with communication. Fine. They don't communicate well. So introvertedness which comes out of lack of communicating skills. See, a person can be introverted because of various reasons. Why is Ethusa introverted is he does not have that communicating skills. Fine. He is not a very intelligent guy. Okay. So he generally avoids meeting people. First point. Second thing, what you also have to understand is Ethusa is a pet lover. Ethusa is a pet lover. Many times we have people coming to our clinic. We have great pet lovers with due respect to them. People who love animals. And many Ethusa patients have this statement telling they are more comfortable with animals than human beings. Okay. They communicate well with animals than human beings. So love for animals, animal lovers. Okay. One remedy that can come up is Ethusa. Okay. And you will be surprised when you have patients in future, you will see them telling, sir, I am very comfortable communicating with animals. They share their feelings with animals. Anyway, I don't know how much they get back, but they are comfortable sharing. They talk to animals. Okay. And one reason why Ethusa are comfortable is they say that in the past they wouldn't have had very good relationship with human beings. I shared my feelings and that person ditched me and I no more trust him and I am comfortable with an animal, and animal will never ditch me is the logic what an Ethusa patient has. Okay. So animal lovers, pet lovers, introverted people and children, especially children who have problems with understanding, okay, who have problems in learning, then they don't understand things easily, okay. So children, yeah, same thing comes up here. Concentration of mind difficult, studying calculations they find it very very difficult. Clear? Okay. So they can't, inability to think or fix attention, you know. See, this is what is coming up even here. They have issues with concentration, they can't concentrate. They open the book, they want to study, but mind keeps going somewhere else, it keeps diverted. Or they are studying, genuinely they are putting an effort to study, in Ethusa they will not understand. They would have studied the same paragraph 10 times, 12 times, but the problem is they have a mind which is not very sharp, so they find difficulty in understanding, okay. So difficulty in studying, difficulty in learning, mind weak, okay, intellect weak, all that is what you have in Ethusa. Now this is these are all related to that. Now what is this I am trying to tell you here is, very good, you see another friend writing exams, and this girl or this patient, you know, there is a paper and she goes blank. So indirectly what I am trying to tell you here is, Ethusa can be a very good remedy for examination fear, okay. Can we have some discussion here? Why Ethusa's examination fear? Huh? So very good. So the problem in Ethusa is genuine, meaning they have not studied, or they have tried studying, they have not understood. So naturally that fear is there. What do I write? It is a genuine fear. We have few more patients, they would have studied very well, okay, but they have fear of exams. There we don't think of Ethusa. You are in second year, now you know the only remedy for examination fear is Ethusa. But as you grow, Gelsemium will come, Argentum nitricum will come, Silesia will come, Lycopodium will come, lot of remedies will come. And each of the remedy will have their own reason for examination fear. And the reason in Ethusa for examination fear is they can't understand. So it's a genuine fear what Ethusa has. Clear? So examination funk or examination fear, see, so beautifully given in your Materia Medicas. Examination fear from simple sense of incapacity. They are not capable of understanding, fine, and they are not capable of reproducing. So there is examination fear. This clarity you need to have as a second year student. Is this clear? Okay. So examination fear, this slide, entire slide is dedicated to the intellect part of Ethusa. The intellect is affected, it is weak, and children who are foolish, who are not mature, fine, for their age, how they need to act, for their age, how they need to behave, that clarity they will not have. Many times we use the word idiot, idiocy, okay. So Ethusa is idiotic, they have issues in understanding, they have issues in comprehension, okay. So, okay, now one more very important thing you commonly come across the Materia Medica is delirium, okay. Now any quick idea as a second year student what a delirium is? We will keep it simple because it is a second year class. What is it? What is it? Okay, they are into their own thoughts, good, very good. Then, very good, there is confusion, beautiful, correct. One word is disturbance of mind. Mind gets disturbed, okay, and the result of which is confusion, the result of which is thoughts. For example, simple example will be if you have got high fever, 104, 105, then you start talking something irrelevant, or you start seeing something, you start hallucinating. Ma, there is this, Appa, there is that, etc. But we know there is nothing like that. So it is a disturbed state. Okay? In Ethusa, in delirium, what will happen? Each homeopathic remedy in a delirious state can behave different. This is what our master Dr. Hanuman said, individualization. Though it is delirium, though it is a disturbed state of mind, each of our homeopathic remedies can have a different state. Now in delirium, in Ethusa, what do you see here is, you see that the child will be seeing rat, the child will be seeing cat, or the child will be seeing dog. If you see, all three are not very friendly creatures. Okay? He will be seeing rat running, or behind that cat running, behind that dog running, whatever. So he may tell, see, under the table I am seeing rat, I am seeing cat, or I am seeing a dog. So in delirium, this is how Ethusa will be reacting. Okay? You also have arnica, which is done. How will arnica react in delirium? What will arnica tell in delirium? So what I am trying to tell you is, you have a remedy arnica, you also have a remedy Ethusa, both of them having delirium, but each of them are different. In arnica, in fever, what will the patient tell? I am fine, I am well. He will be having 105 fever, he will be burning hot, but then what will the arnica tell? I don't need a doctor, I am absolutely fine. So that is arnica. In fever, what is Ethusa telling? In delirium, what is Ethusa seeing? He is seeing rats, cats and dogs. You are getting my point? Okay. A disturbed state where each of our remedies can come up with a different situation, with a different thing. In Ethusa, this is what the child sees in delirium. Okay. So moving ahead, we will be focusing on the second component, and that is GAT. Now before I take up GAT, mind, is it clear? What are all the key points in Ethusa? One thing is, first thing that should come to your mind, fool, or people who have got less or lower intellect. Their IQ is low when compared to a normal human being. Good point. And what happens because of that low intellect? They have issues with understanding, comprehension, concentration, there is confusion, and this is ultimately leading to exam fear. In a child, exam fear, because he has no capacity, there is incapacity. Done. And in delirium, what do they see? They see cat, rat and dog. One point we missed was their introvert. Very good. Why introvert? Because they have issues with communication. Beautiful, good. Last point. Very good. Pet lover, animal lovers. They are very comfortable with animals. All fine. We'll take up the next component. Now GAT. Under sphere of action, what did I tell you? Acting on GA, acting on GA, what will Ethusa do? Ethusa will cause, very good, vomiting. Or before that, we will have one thing. What is that thing? Is why they have GA complaints in Ethusa. Why GA complaints in Ethusa? Okay. What are all the cause? Ailments from? Very good. Milk, good. Huh? Okay. Fatty food, agreed. Fried things, yes, possible. Fruits they don't like. They have an aversion to fruits. Cheese, they like cheese. Okay. So first thing is milk. Okay. And second thing is improper feeding. For example, the child is fed. If you read Dr. James J.T. Kent's Materia Medica, he beautifully says the child is overfed, okay, and that is why the child will go into vomiting. I will explain that point a little later. So under GET, the first thing we are focusing is what are all the causative factors. Ailments from milk, summer can give rise to vomiting or summer can give rise to diarrhea, and a combination of that is cholera, good, or complaints which comes from dentition, okay, and complaints, see, this is what Dr. Kent says. I have taken this symptom from Dr. Kent's Materia Medica. Anytime the child cries, what will the mother do? The mother feeds. See, the reason for child crying could be many, but what do we assume? The child is hungry and you feed the child, okay. So overfeeding, overfeeding can also affect the digestive system of the infant and it can give rise to GI complaints. So go systematic. First you write the causative factors, okay, and then we will try to understand because of all this what might happen in Ethusa. So what do you expect under GA? Under the upper GA, stomach, what do you expect when you overfeed or milk which they have an aversion to is being fed? What is it that is happening? There can be vomiting, good. Vomiting, there can be regurgitation, very good. Now vomiting, in Ethusa, there is something which is characteristic. If you, yeah, very good, vomiting which is violent, I am happy. You recall that point. Vomiting is violent, good, and vomiting in form of curds, okay. I will show you an image. Yeah, child, see, there is a, yeah, we will come back to this. First thing what I want to focus here is vomiting. Vomiting after milk, and milk is vomited in form of curds, first point. Second thing what you also have is after vomiting, what will happen in the child? The child will become hungry because he has taken out everything. So what will the mother do? Or the child will cry, mother will feed. What will happen? The child will vomit. So this is a cycle you see in Ethusa. Child vomits, after vomiting child will feel weak, hungry, child is fed, child vomits. Just keep repeating this cycle. This is what happens in Ethusa. Remember the cycle, okay. And milk is vomited in form of curd. Beautiful picture from Google I have taken. Milk is vomited in form of curd. Okay. So this is very important. And after vomiting he will feel hungry, he will feel very weak, he will feel drowsy. Violent vomiting, violent retching. You can think of Ethusa. Okay. So going ahead, yeah, this is what you see. After vomiting the child will become drowsy, the child will become weak, and child will start crying, fine. So this is a beautiful pictorial representation of what happens in Ethusa, okay. Just capture this image, keep this so that you remember the events, the cyclical events that happens in Ethusa. Clear? Shall I go ahead? Okay. So what you also have in Ethusa is, we saw the upper GA where you saw vomiting. You also have nausea, very bad nausea, vomiting, weakness, drowsiness, hunger coming up. This was upper GA. In the lower GA, what you see is there is diarrhea. Diarrhea wherein the stools will be watery, greenish stools, and undigested, thin, watery and greenish stools. Yellow, greenish, slimy, these are all the character of stools in Ethusa. Okay. So after vomiting, again the child will become weak and there is drowsiness. So much of fluid going away, dehydration happening. Okay. So can you describe this image? Very good. Yeah, your CRS got it right, but just describe the image. See, this face is called as Hippocratic face. Again taken from Wikipedia or Google, I am not very sure, but this is Hippocratic face. Many materia medica remedies, they would have given Hippocratic face. Now what is Hippocratic face? It is not face like Dr. Hippocrates, no. It was he who described this. Now if you see this, what do you see here? Okay, eyes open, good. Huh? Sunken, very good, somebody got it right. Mouth open. See, if you just look with due respect to the patient, if you just look at the patient, she is almost in the deathbed. With due respect, she is almost in the deathbed. Fine. So when you see a patient who is almost like this, eyes sunken, gone in, there is no fat over the cheek, very weak, very pale, as if there is no life. No life. So this is what Dr. Hippocrates, or Hippocrates, great man, he described this as Hippocratic face. Is the change produced in face by impending death or prolonged illness. Sunken eyes, dry tongue, skin of the face dry and hard, pale, dusky face. So tomorrow in your materia medica, when you read Hippocratic face, it means all these things. You need to remember, it means all these things. Clear? So Ethusa also has Hippocratic face. Okay? And so GA, what did you understand in GA? We spoke of the ailments, the causative factors, then we saw its affinity for the upper GA. There is indigestion, okay, there is nausea, there is vomiting. What is vomited? What is vomited? Milk. It is vomited in the form of curd. Curd. Okay. And that cycle, please remember. Fine. And lower bowel, what we saw was diarrhea. Diarrhea. Vomiting and diarrhea is cholera. Cholera infantum. What does it mean? Cholera in infants. Cholera in infants. Cholera can also happen in old. Cholera in old men. But symptoms should be the same. Vomiting, diarrhea, that Hippocratic face, all that. Okay. Now the last component of Ethusa is CNS. So what do you have under CNS? We have, very good, one word that should come to your mind is convulsions. What was peculiar about convulsions? Yes, good, I am happy. First word is the convulsions are violent. Very good. And eyes turn down. Eyes, generally in convulsions it will be turned up. Okay. The eyeballs in Ethusa will be turned down. Good. So thumbs clenched. Okay. Clenching of the thumbs, clenching of the teeth, face becomes red. These are a few things. Violent, which you have already mentioned, violent convulsions. Pulse will be very small, hard and quick pulse. Dilated pupils. Your friend was talking about pupils. Pupils will be dilated and like staring, as if they are looking, staring at you. And your friend also was talking of froth coming from mouth. So violent convulsions. The highlight or the peculiaris is what? This is very important. A 3-mark question asked in your exams. Convulsions of Ethusa. A 5-mark question, cholera of Ethusa. One more 3-mark question is mental symptoms of Ethusa. Okay. Jaws locked. These are all things which happens in Ethusa. Now last thing here is modalities. When are the complaints aggravated? 3 to 4 am in the morning, evening, warmth, summer, milk. You can also write dentition. It is missing, but you can add open air, company, or walking in open air are the ameliorating factors in Ethusa. Okay. Now the key points before we close. The key points is it can be a remedy for attention deficit. Okay. Meaning they are not able to concentrate, they have issues with the intellect, okay, and it can be a remedy for cholera, very good remedy for epilepsy, also a very good remedy for milk allergies, and indigestion, okay, we can think of Ethosa. Yes. Huh? Okay, fine. So your friend was trying to tell that there is amelioration company. Though we saw that he is an introverted person, okay. So I am not very sure in which situation this is there, but basically they are introverted. Let me just check this. Fine, it's a good catch. I missed this. Don't know, not very sure. I can just justify for today's class telling they are pet lovers, okay, but what is that situation we need to understand. Let me check and get back, okay. Any more questions? Yeah, any questions? So the focus will be on mind, GA, and of course the convergence or CNS. Yeah, and color, of course, the GA. Clear? All of you? Okay, thank you then, thanks.